In Chapter 1, the fundamental research problem in organization, behavior and job-related attitude and performance of the organization. In this research, mostly of the employee having negative attitude when it comes to workplace. In order to sustain the performance of the business firm, the relationship between these variables is critical in every company. Job performance is considered one of the main aspects affecting the development of the organization, particularly in healthcare service and the medical profession. So, due to the service sector was dominated by people, the emphasis is on elements that lead to employee happiness. The health sector is one that is dominated by human. Only by emphasis worker, the sector will able to thrive. Then, in the background of the study, the health sector is one of the most important systems in a society that must run smoothly. Healthcare has grown to be one of the most important industry, both in terms of income and job. Several studies have shown that doctor performance and attitude toward work are linked to job satisfaction, which with organization expecting better performance from employees who are content with their job. As a result, to taking care of patients, the hospital should also create a positive working environment whereby a current worker and work team could indeed achieve their own future outcome through personality job performance that related attitude that satisfy their need and desire when while serving the best interests of the organization and the patient. The research aimed to integrate the macro viewpoint by building a framework and presenting a more true view of how much type of employee participate in quality service performance and currently what type of factor that support employee success. For this objective final year project, the first one is to examine the appearance of the negative behavior between multi-professional group members inside an inpatient hospital system using the negative behavior in healthcare survey. Second, to assess how this negative attitude affect patient safety as measured by hospital. The last one is to identify the relationship among job performance of workers in health sector. In Chapter 2, the negative attitude and behavior of health workers at Hospital Cebu toward patient population in the present research may be clarified. Employees are encouraged to have a positive attitude toward both internal and external customers. Negative attitude has been continued to become an issue of frustration for manager, authority, patient, as well as some employees seen it had some significant impact on organization progress. In Chapter 3, which is methodology, so in this research, the effect of negative attitude employee on job performance in health sector was carried out in some at hospital in Cebu. It had been noted that attitude around disability had been the most significant impediment to handicapped people full engagement in the majority of social sector. It has been said before the employee attitude influence their work performance. The same may be said about how a negative or positive attitude toward work affect perform in the workplace. The target of population for this research divided into two groups, which is over the age of 90 and above. The group consists of health staff, particularly nurse and patient who receive the treatment. A sampling frame for this study is health worker at Hospital Cebu. The population health worker in Hospital Cebu is 1,000 people, and it's very had large group of this community. For the data collection, individualized interview were done for patients over the age of 19 and observations were recorded and actually written as part of the sampling tool. The data was collected with mixed method, which is in primary data and secondary data. Primary data is type of the data collected by researchers through interview, survey, and observation. Then, for secondary data, it's referred to information that has been gathered and recorded for other purpose. So it is sometimes referred as a second-hand data. This source was included several past research, journal, newspaper, magazine, ebooks, and online article. To clarify the data analysis, the information was gathered. Data was evaluated through descriptive and explanatory research statistical tests to elicit responses. Either confined and wide questionnaires were employed.